What is recently going on with the Nipah virus, a new virus that has appeared in India? Now the OMS is saying that this could become a new pandemic, but what is the reality? Where is it coming from? Is it something that's been grown in a lab, maybe just released like it was in the past? Or is this a real animal-borne virus? Where is it coming from, and why should you be worried or not about something that is putting the health system in high alert? The Nipah virus is something that is being seen today in India. It's caused the death of 2 health workers that are actually now being investigated of who they have been in contact with. So far, 190 people have been isolated because they could be infected with a virus that causes a 40 to 75% mortality, unlike something like the COVID that would cause a 1 to 2% mortality. This is a lot worse, and 190 people have been isolated to watch for any symptoms that I will reveal to you in just a minute. Now, the Nipah virus is a zoonotic virus, meaning it's an animal or human infection that it can infect humans and other animals, and it has been discovered in 1999 in Malaysia. There have been outbreaks in the past, but this one in India is causing quite some concern because obviously we've been through this before. 5 years ago, we saw COVID, something that started very small, coming from a bat, just like this virus comes from a bat. You're seeing now that could explode into a new pandemic or not. Well, depends if it's something maybe blown up intentionally or not. We have to make sure to be very careful. Now, one thing is certain, and it's that the Nipah virus can cause fatality rates to skyrocket from 40 to 75%. This is very dangerous. The Ebola virus can barely meet 50%, and it's very, very dangerous. But this virus, which can be transmitted from human to human or animals to human or humans to animals, is something that causes quite some concern. Just so you know, after exposure, initial symptoms usually appear within 4 to 14 days, though in rare cases that might take a little bit longer. Some of the first symptoms are just like a flu. You might see fever, headaches, muscle pain, fatigue, vomiting, sore throat, or even coughing. But the problem comes in the fatal phase, or the second phase, which is very dangerous. It's very hard to take people out of this phase because they start to see encephalitis, which is basically inflammation of the brain. They start to see dizziness and confusion, seizures, altered consciousness, or even coma in severe cases, which obviously means they're just at the border of death. Now, the treatment is actually something just palliative. People are introduced into the hospital, they're taken care of, they are given IV fluids, they're given everything they need to stay stable, but the reality is that there is no vaccine, God for that. At the moment, there are no vaccines, and by the way, we just don't know right now if that's good or not, but the reality is that there's no specific way of treating these patients. The OMS is treating this pathogen as a high priority pathogen, something that could cause a high and serious risk potential for a new pandemic, which hopefully there will not be, because this only has been seen in 2 patients and another 190 that now are on observation. Obviously, we need to be careful with these 190 patients to make sure that any of these are not infecting others, and that we're not seeing this just as a domino effect that cannot be later controlled. Now, the good thing about this is that there has been early detection, and hopefully we will not be seeing anything that we did see 5 years ago, which quite frankly did affect us in every single part of the world. So don't forget to give us a like button, don't forget to share, and I'll keep you updated if there's any new information. Take care.